It was here at the University of Glasgow where I was equipped for a career in public service. And it's that duty to serve the people of our country that still drives me every day. I graduated from here in 2005. 2 years later, while I was working as a young man in the NHS, the SNP came to power in Scotland. They came to power promising to deliver for the people of Scotland, but now almost 2 decades later, the question is this: do you really feel things are better or worse?
In 2022, I felt a bit unwell. Advised to go to A&E. I discovered that as well as chest pains, I had extremely high blood pressure. And we had quite a long journey then for a diagnosis. So things escalated. Started getting increasing chest pains. I go back in an ambulance, back to hospital, off work, back to work, more sort of like heart sort of problems, back to hospital. And the first thing I discovered is that I wasn't actually on the waiting list to see a consultant, even though I had been asked to put on the waiting list. Several months elapsed of this sort of like journey backwards and forwards to hospital, changing drugs, and eventually I saw a cardiologist, and we had some tests run, or we had some tests. We were going to run some tests, but again, the waiting list for that was extremely lengthy. I did consider going private, and unfortunately, that was going to be around about £30,000 to get all of the tests done required to get a diagnosis. It got to one point that I was resuscitated. I hadn't gone fully under, but they caught me, and again, as A&E is brilliant, they got me back up on my feet. And then just showing how sort of like dysfunctional and disorganised the whole system has become, the consultant rings me with my diagnosis. That's 9:30 on Thursday night, and you have to wonder about what sort of pressure is being put on the staff.
I've worked in the NHS as a consultant for 20 years now, and things are not good. I think the problem in primary care is that GPs haven't been resourced adequately for the work that they do. Essentially they're running little mini health services looking after all sorts of different diseases, conditions, from hearts to heads to all over. And to do that properly and to be able to respond to patients' needs properly, they need to be better resourced. And when they're not, then that spills out into the hospital system, and people end up in emergency departments because their GPs can't do anything, and then the emergency departments get chock-a-block, and then it takes longer to evaluate people in emergency departments, and then people get admitted to hospital that might not need to be in the hospital, and then we've got no hospital beds, and then because we've got the problem in the care sector, we can't discharge people from hospital when they're ready for home or for rehabilitation. And so the whole system just gets gummed up. And there's been a failure of management and decision-making at each of these levels over the last decade or so, which has led us to the place that we're in.
When the SNP came to power in 2007, they inherited an NHS in robust health. But in the SNP's time in power, they have plunged our NHS into permanent crisis. In the past year, health professionals have been calling out this failure. In November, a damning report from the Independent Institute for Fiscal Studies told the Scottish Government Scottish hospitals are buckling under the strain of SNP incompetence. The report said that in Scotland, hospital activity remains below pre-pandemic levels, and waiting time performance has worsened over the last year. The same is not true in England. Scots cannot continue to pay the price of SNP incompetence.
Over the past 4 years, since I became leader of the Scottish Labour Party, I've travelled the length and breadth of Scotland to listen, learn and understand your priorities. And the message has been overwhelming. People across our country feel things have got worse rather than better. After 18 years of the SNP, it doesn't have to be this way. The Scottish Labour Party will always defend the NHS. It's in our DNA. We created the NHS and we need to save it again. And that opportunity to deliver a new direction for Scotland will come in May 2026, just 16 months away. We have an opportunity to change our government here in Scotland, so let's work together to deliver the change our country so desperately needs.